I am really optimistic about this pilot program. As most people know, it was tried several years ago, had broad bipartisan support, didn't ultimately make it through the process, but this time around, not only does the legislature support it, I think with Democrats and Republicans, but Governor Walker's the one who thought of the idea. So I look at this as a real creative way for us to continue to remind people that medical care, especially dental care for people who are on Medicaid, should be provided by private small businesses, just like these dentists who are looking to do it. So I am really optimistic. I'm going to fight hard to make sure it stays in the budget because I think it's good for not only the 3 counties that would be the pilots, but hopefully the whole state once we're able to show it works. Because I want to use this 3-county model as really an effort to continue the model statewide so we can increase reimbursement rates for dentists. So making sure we have adequate opportunity to show that it works, showing that the patients that were able to come in because of the increased reimbursement, the hours of care that we're given, the number of patients, and the opportunity to really improve their quality of life, all those are going to be crucial if we want to increase the funding over the long term to more than just those 3 counties.
I was really pleased to see that in this budget, the governor had included a 3-county pilot program for Medicaid reimbursement rates. It's something that I've worked on for many years when I was in the Assembly and now serving in the State Senate. And I am pleased to see that between Polk, Brown, and Racine County, that those are the 3 counties that have been selected. I think it's much easier to keep something in the budget than put it in at a different process during the budget. So I'm really hopeful that the dental care pilot will stay and remain in the budget as it works its way through the Joint Finance Committee. I think there will be some need for some clarifying motions or amendments to kind of talk about sort of what the benchmarks will be and also to kind of look at the HMO model and the fee for service. So I think there'll be some clarification language that will be needed, but I'm optimistic and I'm really pleased that that this is in the budget this year. And again, it's something that's not a Republican or Democratic issue. It is one about the tooth party, and all of us care about good oral health care in our communities and working with our dental providers to make sure that it's possible.
I think this pilot's going to make it through the legislative review, but right now it's in the governor's budget, and that's where we want it. It's so much easier getting things passed through the legislature if it is included in the budget. So we need to work with the members of Joint Finance and the other members of the legislature to hold that piece of legislation in the budget so that we'll have the ability then to improve people's lives and start this pilot project to be able to document that there's major improvements that are made in doctors' participation and usage of the program so that we know that it's working and that we can move to expand it as we move forward. We've already identified the areas that we need to do, and we're working with the American Dental Association to identify any other areas that might be beneficial to track, because we do want to document that the program is useful and successful. And if we can show that, we'll be able to expand the program as we move forward.